Welcome to Quickmedtalk, the online destination for medical lectures. Let's discuss Hordeolum and Chalazion. Definition. Hordeolum, which is a stye, is a common acute inflammation of one of the sweat and sebaceous gland around the eye follicle. Classified according to location. External Hordeolum. This inflammation of the mole of the Zeiss gland on the anterior lid margin. Internal Hordeolum. This inflammation of the meibomian gland on the posterior eyelid, which is a palpebral conjunctiva. Chalazion is a focal hypogranulomatous swelling of one of the sebaceous glands around the eyelash follicles. On etiology. Primary causes. Hordeolum is caused by infection with Staphylococcus aureus, and Chalazion is caused by obstruction of the sebaceous glands, which are Zeiss and meibomian gland. Risk factors which are similar for both Stye and Chalazion. Ocular, poor eyelid hygiene, eyelid trauma, and meibomian gland dysfunction. Dermatologic can be seborrheic dermatitis. Clinical features. Onset. Hordeolum is sudden, while Chalazion is slow growing, which is chronic. Appearance. Hordeolum is painful, erythematous sparse-filled nodule on the eyelid with associated edema, while Chalazion is firm, painless slabbery nodule on the eyelid. Everting on the eyelid may allow for better visualization of the lesion. Other clinical features. Hordeolum may spontaneously rupture with pleurine discharge, while Chalazion, there is heaviness of the eyelid, which can cause visual disturbances if large enough. Management. Diagnosis is clinical. Conservative management. Gentle massage with warm compression for 10 to 15 minutes 3 to 5 times daily. And regular eyelid hygiene. If symptoms persist or reoccur, apply topical antibiotics, example erythromycin, with plus-minus topical corticosteroid. Oral antibiotics, example doxycycline, and procedural interventions, example incision and drainage or curettage. Of note, Hordeolum typically resolves within 2 weeks, and Chalazion typically resolves in a month or more. Complications can be preceptor cellulitis and orbital cellulitis. Thank you. Do not forget to like, comment, share, and subscribe. In the bio, you find the link to our Instagram, Facebook, and Slideshare account.